Nurses met with Governor Brown in Sacramento and rallied in Oakland to demand that California adopt safety standards to protect nurses from getting Ebola.
KUSI's Kristen Casado was at one local hospital when shipments of safety suits came in today. Scripps says they are ready for anything. And Kristen joins us now.
So here it is, you guys, just to let you see it. This is one of the safety suits from Scripps meant to protect healthcare workers as they deal with potential cases of Ebola. Today, Scripps started training doctors and nurses in 4 emergency rooms and 3 urgent care facilities, and they'll be training all week. They have arrived. Boxes and boxes of full-body suits at Scripps Health. 1,000 to use for training employees, the white suits made of a thinner material, and 850 of the blue suits for use in dealing with potential cases of Ebola. Scripps Health has recently adopted the Doctors Without Borders protocol for dealing with infectious diseases.
It includes, a full bunny suit. It includes face mask, double gloves, non-skid boots.
And they are developing a system for healthcare workers that does not allow mistakes. It will take 3 people.
A nurse to take care of the patient. It takes a safety observer to be in the room with the nurse, and which is another caregiver, essentially 2 caregivers, and a safety monitor that runs the checklist of getting in and out of the personal protective gear.
Perhaps that is the way the nurses in the Dallas hospital that treated Ebola patient Thomas Duncan got infected, through mistakes while taking off the suits. Since then, hospitals all over the country have held drills, like this one at Rady Children's, so they know what to do if someone with the disease comes through their doors.
If you look at some of the drills that some of these hospitals have done, you have exposure of skin. Because I'm no expert on Ebola, but the full exposure, it keeps changing from the CDC's guidelines.
That's why members of National Nurses United met with Governor Jerry Brown, asking for California to be the leader in setting new rules for hospitals to protect healthcare workers.
Nationwide, if new guidelines are coming out, no, we're not prepared. We need robust, hands-on training with your buddy and with your coworkers and with your team.
But the chief medical officer of Scripps Health, James LaBelle, says it takes time to revamp their system, hence the continuous retraining of healthcare workers. If nurses and doctors don't feel safe, he says, it will be difficult to take care of patients. Societal panic about a disease that is very hard to contract is not helping.
Everybody just needs to take a deep breath, recognize that we are committed to making sure that our healthcare workers are safe, and I personally have confidence in that.
And as we have reported, Scripps had 2 false alarms in the last week, which offered them real-time practice in dealing with patients sick with Ebola. There have reportedly been 7 false alarms across the county. Health officials tell us Ebola is not in San Diego. Ellen and Sandra?
All right, good deal.
Thanks, Kristen.